All right, good afternoon, everybody. Like to call.
Very start to fun.
Call this meeting to order. Today's Wednesday, December 18th. We can get approval of November 22nd, 2024.
Sure, I'll make a motion to go ahead and approve the November 2022, 2024 regular meeting minutes.
I'll second the motion.
Motion is second. All in favor, say aye.
Aye.
Any opposed? All right, the ayes have it. I'll move on to public comment. Anybody here? I don't see anybody.
If you'd like to make a comment and you are online, you can press *9 on your phone, or you can raise your hand inside the Zoom app.
Commissioner or Chairman McKay.
Yes.
We have concluded our meeting. I am now presently on the meeting.
Okay, perfect. Thank you. Is Rocky on there too then?
I'm looking. I see Commissioner Didier. I don't see Commissioner Bullen yet.
Okay, so he's probably gonna go. Okay, perfect. All right, so I don't see anybody online. Okay, so we'll close public comment. Senior staff comments. Moving right along. New business. Office of Health Officer update. Dr. Krager.
Hello, everyone. I hope the holidays are treating you well. I'm going to keep things brief today as well. It is, a week away from Christmas. Couple things I just wanted to mention. We are seeing an uptick both statewide as well as in Benton and Franklin counties of both influenza and respiratory syncytial virus, or RSV. That data is hospitalization data, so we are starting to see it's still comparatively low to like a peak that we might see in those viruses, but we're seeing an increase, which to me means we're kind of entering that season. So COVID-19 activity remains pretty low, which is good. But yeah, just a reminder for people who are eligible to get RSV vaccines as well as influenza and COVID-19. The other thing I wanted to mention, and I'm going to put this, let's see, there it is. I'm going to put it on the screen because I think it's good. Just I'm not able to share. Well, that's not a big deal. I'll put it in the chat, or I'll have it send it out to you. But it's just food safety over the holidays. So we probably could have talked about this even over Thanksgiving, but especially as people gather, unfortunately, we just see lots of opportunities for foodborne illness to happen. I will note that our communicable disease team has unfortunately had to respond to kind of multiple episodes of kind of outbreaks, probably related to foodborne illness or at least GI illness. So that is happening in our community, and I want people to be safe with food and just infectious disease in general. So wash your hands, keep your food safe as we enjoy the holidays. That's my update today.
Any questions for Dr. Krager?
Just quickly on COVID, are we seeing an uptick in COVID as well, or is it?
No, it's relatively flat. We had a little bit of an increase kind of over the summer, and that's been on a downswing, and then it's kind of remained at this very low level. Yeah.
All right. Thank you, Doctor. Move on to on-site sewage rule updates.
I'll call them up. Okay. All right.
Yep.
Okay, so been up here way too much with the changes to the on-site sewage regulations. So these are the changes that that you guys had concerns about. The first one is, there were two really that I felt that you had questions on, and that was regarding homeowner installation and the homeowner design of the system. So with regard to that, with regard to homeowner installation, we will be, I just want to make sure that you realize that we're not saying they can't do it. They still can install their own system so long as it's a conventional gravity with no electrical component. They are still able to install their own system. They are able to install one system every 2 years and we'll look at, if there's an ADU or accessory dwelling on the same property that they live in, to letting them install that one as well. And we will look at those on a case-by-case basis, probably as long as I think a relative is living in there, that would be fine. And then the other one is the ADUs, because a lot of times the permit is in the name of the person that's going to be living in there. That we would allow a close family member to do the installation, so long as they passed a competency exam. And the exam is just going to be about 20 questions and really just the basic, how much space do you need between the tank and the distribution box? How much fall do you need between the tank and the distribution box? It should be something that's really easy for them to take.
I just want, sorry, I'm gonna go back to one more bullet point you just had, where it says, I just want to make sure, because we had our legislative send off yesterday. So we had a bunch of state senators and state legislators in our office. And one of the asks was from Michelle Mercer in our planning department was for the county, for them to go back and ask if they're, to allow auxiliary units or family owned other secondary units or houses on that property. And so long as, I just want to make sure that we would be okay, once again, if they get that ask and it's permitted within county parcels of property, as long as it's a family member, that they should be good to go with that conventional gravity system. Is that correct?
Yes.
Okay, that's what I thought. I just want to make sure.
They still have to meet the land use sizes.
Sure.
They still have to fit.
Yeah, makes sense. Okay.
That one. And then the other one was the homeowner design of the system. While we would definitely prefer that they have an engineer or a on-site system designer come up with the plot plan, we will entertain a homeowner design for the fee. And the fee would be $150, which would include us sending it back one time and then correcting it. And if we have to send it back 2 and 3 times, we have the ability to charge another small amount the time that it takes to review that. And that's all I have for that. So Karen?
Oh, yeah. Okay. I'll do the next couple slides. So like Jody said, we last month had concluded with bringing all of the new changes to you all, and she just wanted to bring those 2 back today because those were the 2 that we had the most feedback from the board on. And what you saw today constituted some tweaks from that original presentation. So we went back, reevaluated, and then I think, as was suggested, just accounted for the extra time that our staff are going to end up putting into some of the homeowner designs to capture some of that through fees, but still allow homeowners that flexibility to do their own design and install if they have that capability. So I wanted to talk about the next steps with our process, because we have sort of a tight timeline that we want to stick to if we are to align our implementation of our rule with the implementation of the state rule, which we want to make sure that our local ordinance goes into effect at the time or before the state rule, because if it doesn't, then the state rule is just going to flat out supersede our rules, and that's going to be a huge issue. So the state rule goes into effect April 1st, 2025. So again, there were a lot of provisions in our rule. They're pulled over from that state rule, and those will go into effect regardless of what we do. Funky clicker, sorry. April 1st, 2025. So there are a few sections of that state rule that they put a delayed implementation on. So notably the maintenance service provider approval requirement, which is a process we have to work on, which is tied to the property transfer inspection requirement. So starting in February 2027, every property that is sold that has an on-site system on it in the state has to go through a property transfer inspection, and we are the office that has to perform that inspection. And that's a state rule, not under our control. So the maintenance service provider approval is we can certify other entities to do those inspections, and then they would send them to us and we would review them. So we have to have some sort of system in place, however, for certifying like an installer or somebody who could perform the property transfer inspection. So that'll be a big push for Jody's program over the next couple of years once we get done with this rule, then to move on to coming up with a system for a whole new inspection program, essentially. So that's the next steps on the big rule. And then at the BFHD level right now, where we're at with the rules and regulations number 2 is we are starting to put together our SEPA environmental review application. So our rule, because it has environmental impact, we have to go through that SEPA review process as an agency. And then next step with this group is we need to open it up for a formal public comment period. So we'll figure out whether we align that with next month's board meeting. We'll have to probably talk amongst our group and figure out when that public comment period will be set, but it'll be announced publicly, you know, with when the begin and end date is there. And then ideally what we'd like is to go to a resolution and vote with the board in February. That way we allow a little bit of wiggle room. You know, if there's still additional public comments or questions that come up by February, then we have March as a buffer to make sure the rule goes into effect by April. So what I'd like to hear, ideally feedback from you all, is what do you feel like you would need to feel confident voting on this in February? Our intent was to come up with we'll have the full draft available for you, but also to come up with a summary sheet for you, which just summarizes the areas that BFHD has changed, so you don't, you know, get too stuck in state changes versus BFHD changes. But if there would be anything else that would be helpful, you know, if you want to set up side meetings outside of the board, just let me know what would be helpful for you going into that February meeting.
Anything?
I think a draft and a summary would be
Yep.
great.
Yeah.
Okay, so we'll be working with Amanda Communications and Jody to put that together, and we'll get it to you as soon as we have it available. Right now, our rule draft is with the Department of Health. They're reviewing it. They have to approve it. So as soon as they give their stamp of approval, then we'll have that final draft, and we'll be able to make that available to you for preparation for February. All right.
Thank you.
Yeah, no problem.
All right, Mr. Kyle.
How you guys doing today?
Super duper.
And just so you know, the printouts of the presentation are in your packets, so make it easier.
So my name is Kyle Phillips. I'm the finance manager here at BFHD, and I'm going to be presenting the 2025 proposed budget for your guys' approval.
Kyle, who is on the finance committee, out of curiosity?
That was Commissioner McKay, Commissioner Mullins,
Okay.
and Carol.
Thank you, Carol. I don't know about those other two commissioners. Okay, thank you.
So we met with the finance committee on the 10th to review the budget, and in that meeting, we went a little bit more in depth than we will be going today. So the proposed 2025 budget will be a balanced budget. As you can see by the slide, the budget is going to be at a little over $17 million. It's a 7% increase from the prior year. The main revenue increases were from state and federal grants. And the main increases to expenses were from salaries and some subcontractor service. Our approximate fund balance right now is about $5.9 million, which represents 91 working days of cash on hand. Our goal is to remain over 90 days. So we're at a good spot. On this slide, we see the revenue breakdown compared to last year. Licenses and permits increased mainly due to fee increases that were approved last month. The state and federal grants increased due to some WIC increase in funding and some other grants, including the Cannabis Tobacco Prevention Program. Fee for service decreased to more accurately reflect the volume of services provided. For expenditures, our salaries remain the highest portion of our budget at 74% of the total. Supplies increased mainly due to the cost of goods, and our services increased due to some new subcontracts in the tobacco program. This is our organizational chart, which changed a little bit, but not too much. Staffing levels for 2025 increased slightly. Most of those were approved last year.
Do the departments feel, I'm just curious, do the departments feel like are they pretty much fully staffed now, or you still trying to fill a lot of positions? I gotta ask, because when you talk numbers like that
Right.
helps future, look at the future of the midterm and long-term for financials.
We have some open positions, but not too many.
Okay.
There's
Okay,
like 5 or 6, I think.
so you feel pretty well staffed overall.
Yeah, I mean, there's certain departments that definitely would appreciate an increase in staff, an FTE to
For the
help with
budgeted
the workload.
positions. Okay. Okay.
Here's the projected revenue and expenses by division. Our Healthy People and Communities is heavily grant funded, while S&I is more permits and services, and our admin is more discretionary funds. Most of our expenditures are salaries and benefits, and these are kind of spread out along the program lines. So in conclusion here, the proposed budget is $17 million, which is a 7% increase. The budget is balanced with no cash reserves being used. And the finance committee has reviewed and discussed the full budget and recommends the board approve.
Quick question.
Yes, sir.
So I can understand how administrative expenditure would be like 30%. Can you give me an example of where an administrator would generate money, revenue by division?
Mainly due to for that, it's the discretionary funds. So any funding that isn't tied to a program is funneled to administration. So it doesn't bring in funding, but the fact that we get discretionary funds from like the county and some other sources, it's put to there since it's not program specific.
So just at a location.
One more question. So I know you basically have a 3-month reserve.
Yes.
And so how long has that 3-month reserve been intact? Has that just been normal practice? Or has it in the past been 6 months in reserves? I mean, I'm just curious, because it's pretty skinny at 3 months. If anything happened. So I was just curious to see if that's always been the normal practice of 3 months, or has it been longer in the past? I didn't have a chance to look. I don't have my reading glasses.
It's been steadily increasing. 90 days is the goal that we shoot for. It hasn't.
You guys haven't gone for like 120 days or anything like that.
No.
You feel comfortable with 90 days?
Yes.
Okay.
And that's actually only been the last probably 6 or 7 years, because prior to that, the board put in place some guidance to support us in requiring.
A reserve account? Yeah, so if there wasn't in the past, wow, okay.
So that's good to know.
Yeah, that's good.
So we are moving in a positive direction.
You're operating it as a business in that way. Okay.
Exactly. Yeah, perfect.
Any other questions?
I got to attend the budget detail and it was really good.
Yeah.
We asked a lot of questions. The takeaway was that we're getting more revenue from these federal and state sources, so that's upped our revenues. But it also commensurate with that, it's also cost us a little bit more expenses because we're gonna have to do some subcontracting to deliver some of those programs. But I thought it was a good presentation.
No, I appreciate everything, all the hard work you guys have done with staff, and I know we do think alike when it comes to business and stuff. So that's why I wanted to find out. So you're on there and you like it. I'm good with it. With staff.
Yeah. Okay. So we need to get a motion on that.
Can I move for approval
Yes,
of
ma'am.
the budget?
Yeah. So you'll,
Did you do it?
You need to say 2025.
2025 budget.
Okay, we have a motion to approve the 2025 budget. Can we get a second?
Second.
A motion to second. All in favor, say aye.
Aye.
Any opposed? Ayes have it. All right, any announcements, if any?
I'll add to that, one of the things I mentioned to the that committee, budget committee, was that we had some outstanding grant applications. We have received one of those since then, and we still have two more that we're pending awareness of, so we already are out of date. Poor Kyle already has to deal with another grant.
But in a
income
positive
revenue,
direction.
in a positive direction, correct.
For how much of those grants?
That's, the first one we know about is $100,000, and it's Kennedy Safety Grant.
I just got one last thing.
Yeah.
I just wanted to go ahead and say, you know, at the end of the year, I think this is our last meeting until next year, is appreciate everybody here that works for Benton-Franklin Health District. You're all very valuable to the community in both counties and stuff. So once again, happy holidays. Thank you for all you guys do. Appreciate everybody on the board here and my fellow commissioners and stuff as well. Happy holidays on that. And we'll continue to go ahead and go fight for better and the best when it comes to your organization. Thank you.
I'll add to that too. I just agree, like, it's great working, being on a board when you have staff that have common sense. You know what I mean? Like, that they're making things right, run correctly, appropriate stuff to where, you know, if it's disagreeable, it's like, oh, come on, guys. You know, so I appreciate what you guys are doing. And the stuff you guys are presenting to us and everything's common sense. Yes, it's an easy yes type thing on the stuff that you present to us. So.
And it's a lot of hard work. I can see every time I come up here on a board meeting, I see everybody in here, all the people that are needing help and stuff like that. So I can tell it's you got everybody here at the health district does valuable service. So thank you.
All right, let's move on to approval of vouchers.
I'm gonna try to do this without my reading glasses. Move that the Board of Health.
Do you hold it farther out for that?
That actually helps. Move that the Board of Health approves payment of voucher number 71-2024 through 79-2024 in the amount of $1,085,142.86.
I second that.
Have a motion and a second. Any discussion? Hearing none, all in favor, say aye. Aye. Any opposed? All right. We don't have an executive session, right?
Correct.
Yeah, we don't have one. Okay. All right, well, that was,
Hey.
any comments from the board? We're good? All right, well, I hope we do have just a tad bit of snow, so Santa Claus does come next Wednesday. So anyways, hope you guys all have a Merry Christmas and we'll see you January 15th. Yes, ma'am.
Oh, I was gonna say next meeting date.
Yeah, January 15th. Take the rest of the day off.